Welcome to the World Today on Channels Television. Yes, it's a really good day for Nigeria. I am Onyebuchi Chukwu. The World Health Organization today declared the country Ebola-free. That meeting took place at the Federal Capital Territory, Abuja. The announcement comes as the country has counted 21 days since the last known case was reported on 5th September. Nigeria experienced its first case of the virus in July when Liberian-American Patrick Sawyer was diagnosed shortly after his arrival in the country. His presence at a hospital in Lagos exposed medical personnel to the virus, resulting in the death of one of the hospital's best doctors, as well as other medical personnel who died, unfortunately. We're talking about Dr. Ameo Adedevo. 20 cases were recorded after that incident.
Today, 20th of October, 42 days, it means twice of the incubation period. After the last confirmed case of Ebola virus disease was discharged from the isolation ward, having tested negative for the Ebola virus, the chains of transmission have been broken. WHO officially declares that Nigeria is now free of Ebola virus transmission. The virus is gone for now. The outbreak in Nigeria has been defeated. This is a spectacular success story that shows to the world that Ebola can be contained. But we must be clear that we only won a battle. The war will only end when West Africa is also declared free of Ebola. Ladies and gentlemen, I would like to take this opportunity on behalf of Dr. Margaret Chan, the WHO Director General, and Dr. Luis Gomisambo, the WHO Regional Director for Africa, to congratulate the government of the Federal Republic of Nigeria through His Excellency Mr. President Goodluck Jonathan, the people of Nigeria and all stakeholders and development partners that made it possible to contain the Ebola outbreak in Nigeria. A special word of recognition to all members of the Ebola Emergency Operations Center. Allow me, Honorable Minister, to commend Dr. and Professor Nasidi and Dr. Faisal. The health professionals, the volunteers, the drivers of ambulances, the security personnel, traditional, religious and community leaders, members of the media, and to all my fellow WHO colleagues. In particular, I'd like also to commend my fellow colleague, Dr. Musa, that day and night made this great achievement possible. You are the real heroes.
Yeah, that was a declaration that made everyone happy and feel safer in the country, but perhaps no one could be more delighted than the Minister of Health, Professor Onyebuchi Chukwu, on the certification of Nigeria as Ebola-free. But the minister has warned the Nigerians should not get carried away by the feat, especially given the fact that some neighboring West African countries are still battling with EVD. He said this at a media conference in Abuja. He also challenged the United Nations to provide the needed capacity to repeat Nigeria's example in those countries.
Nigeria has won the battle against Ebola virus, but this world war rages on other fronts in other countries. The war certainly, therefore, is not over. A reinforced Ebola virus could still invade Nigeria. And given this risk of possibility of reinfection, there is the need to maintain the state of high alertness at all our ports of entry. Dr. Sanegwazo, if every other person wants to go to sleep, you cannot. This is the time you are now really having to be very, very focused about the work. We are all looking up to you and your team that our ports of entry will be safe. So you have so much work to do. We cannot afford to lower our guard. This risk and the risk to other countries can only be eliminated through the setting up of a system similar to the Nigerian one under the leadership of the United Nations, but with the operational wing built around ECOWAS. We cannot defeat Ebola in West Africa if we continue the way we're going. The UN luckily has taken charge. Almost all the countries of the world, with the exception of just very few, are members of the United Nations. We should work based as one united world, the United Nations. But the technical team should be built around ECOWAS, because you are dealing with 3 contiguous countries. So it's like one unit. You can take it that is Lagos State, since we have been told that their population is even less than Lagos State. So it's like saying that is Lagos State with one border. But because they are being managed by different governments, so there are borders to be crossed within that region. Therefore, you need a supranational body that will be respected by those 3 countries and to whom they will listen to. That body is ECOWAS.
The Minister of Health, Professor Onyebuchi Chukwu, warning on the fact that we still need to be cautious despite the fact that we have been declared Ebola-free, because we're still surrounded by 3 countries where the Ebola virus has ravaged. Just a few days before Nigeria was declared Ebola-free by the World Health Organization, neighboring Senegal was also declared Ebola-free. The world body gave the country a 42-day maximum incubation period for the disease. It says that it has still warned that Senegal's neighbors still keep it at risk of being infected again, just like Nigeria, because of its geographical position, making it vulnerable to additional imported cases of the Ebola virus disease. Now, that warning cannot be overemphasized. More than 4,000 people have died from the disease. 9,191 known cases still exist in West Africa. Doctors are still saying caution is key to curbing the virus. People must continue to observe health precautions. They're urging people to continue to avoid direct contact with sick patients as the virus is spread through contaminated body fluids. Also, you really should consider wearing goggles to protect your eyes when dealing with an infected Ebola patient if you ever come in contact with one. Also, for medical personnel, clothing and clinical waste should be incinerated, and any medical equipment that needs to be kept should be decontaminated. Also, people who recover from Ebola should abstain from sex or use condoms for the next 3 months. Let's not forget the fatality for the virus can reach up to 90%. The virus has an incubation period of 21 days, and there is no proven cure or vaccine for EVD. Let's talk more about preventive measures now. Dr. Disu Oyewoga is on the line from Lagos. He's the PRO, Society for Public Health Professionals of Nigeria, and Chairman, Lagos State Chapter of the Association of Medical Officers of Health in Nigeria. Doctor, thank you for joining us on The World today.
Thank you. Good afternoon. Good evening.
So let's just begin with, your reactions to the World Health Organization's declaration earlier today. It must be good news for the medical community in Nigeria, right?
Yeah, it is, because we must congratulate Nigeria entirely. It's not just the medical community, it is the efforts or the response from the community, including the partners, the media, and everybody that has 1 or 2 things to do in making sure that Ebola was contained in Nigeria. So it is a congratulation to everybody.
But is this an indication that we really have no need to worry about the Ebola virus again? Although the Minister of Health, Professor Onyebuchi Chukwu, did say that because we're still surrounded by Guinea, Liberia, and Sierra Leone, who have been terribly impacted by Ebola, we're still at risk. So how do we go on?
Hello?
Yeah, Doctor, I was asking, how do we move on from, what do we do now? I mean, how do we move on from here, since we're still surrounded by neighboring countries that are still impacted by the Ebola virus disease?
Okay. Right now, we need to increase awareness and then to sustain vigilance, because we still have a lot of Nigerians who live in Nigeria, and then they come in from time to time. And this is, we are approaching the festive period, Christmas period, where you expect a lot of movement. So, what we need to do, that was strengthening our point of entry, that we screen everybody that comes into the country, and then again, so awareness in the community. In case somebody comes into the country and he is not symptomatic at the time he's coming in, but by the time he gets into the community, he becomes symptomatic. So once the community is sensitized and they are aware, they are alert, then they can quickly detect such a person and then arrange how the person can get to treatment center where the person will be treated and before the person starts transmitting it. So what we need to do right now is to sustain the awareness that is already in existence. And then the media in particular should actually continue to create awareness and then pass the right message to the people, positive messaging. And then we should learn a lot of lessons from the past outbreak, the one that occurred. And so quite unfortunate that the way the media were reporting this outbreak and was a little bit fearful, as it needs a lot of Nigerians to be fearful, and almost affected the response. But over time, they learned their lessons and they began to report it appropriately and in such a way that we could build trust and that would support the appropriate response from the community. So what we need to do is awareness. And then on the part of the health system, and the community preparedness is being done now, as in the existing structures in the community for creating awareness about signs and symptoms of the disease, about who is traveling from what country or other countries into Nigeria. Once the communities themselves know that people come into the country, especially from the Ebola-prone areas, are at risk of carrying the virus, then they watch them and then support them in